Welcome to episode 86 of Talking Dairy. Today we're talking about a challenge every dairy farmer faces at some point, mastitis. So what do you do when your herd test flags some high somatic cell count cows? How can you stop them from causing a bigger problem? Or what if your cell count suddenly spikes? How should you troubleshoot the issue? We've got answers. Joining me today are Mike Shallcrass, who's a senior vet manager from Fonterra. Mike worked in a dairy practice for 12 years before joining Fonterra in 2019. Now he leads their mastitis support program, where staff visit farms to help improve milk quality. Also joining us is Jane Lacy-Hulbert, who's a senior scientist at DairyNZ. She specialises in animal health, milk quality and production. She looks after the research and technical information that underpins SmartSam and InCalf, as well as working with farmers who are exploring extended lactation systems. Both Mike and Jane are members of the National Milk Quality Advisory Committee, which advises DairyNZ on vet and farmer needs for SmartSam. We cover off the best ways to monitor, manage and minimise mastitis to keep your herd healthy and productive. Tēnā korua, thanks for joining us today, Mike and Jane. Before we talk about udder health, let's talk about you. Mike, tell us a little about yourself.
I'm Mike Shallcrass. I'm Veterinary Program Manager for FarmSource, or in the On-Farm Excellence Animals team in FarmSource. So we think about what is good farming practice now, what's it going to be in the future, and how can we help farmers make that transition. Prior to working at Fonterra, I was a clinical vet, mostly in the Waikato for 12 years, and I'm still based in Hamilton now.
And you were our dairy vet on our farm before Fonterra snapped you up. Still grumpy about losing you. What attracted you to your role at Fonterra?
It was interesting. Someone kind of approached me and said, hey, there's this job at Fonterra, you should think about applying. And I was like, nah, what is it? Why would I want to leave? Like, I liked practice. Why would I want to leave? And it's quite hard to describe the job because kind of like, what is it even? Oh, it's hard to describe. Eventually it was sort of, what do you do day to day? You know, what did you do this week? Oh, we had an industry meeting where we tried to work out how methane inhibitors are going to be used. And you're like, oh, that does sound quite interesting. Maybe the selling point for me was the idea that instead of helping one cow at a time, I can help 4 million at a time.
Cool. And Jane, I've thought of you as the mastitis oracle since meeting you when I was a research tech in Taranaki about 20 years ago. But you're more than that, I'm sure. What's your story?
Yes, I've been working on mastitis for quite some time, since the mid-90s, having completed a PhD over in England and came over to New Zealand and just enjoyed being in this world where things you say do actually reach farmers' ears and you do have an impact. And so I've really enjoyed working on mastitis, on milk somatic cell count, milk composition. I spent the last 10, 15 years looking after the resources that sit in behind SmartSam and also looking after some of the other resources that support a lot of the other programs that farmers use to deal with animals on farm and to look after their animals well on farm. So right now I'm still working on a little bit of mastitis, but a lot of it is about looking at how we can help farmers transition to different systems, such as extended lactation systems that may help with labour and with dairy calves.
Thank you, Jane. And we will start with you. To kick things off, can you explain the basics of mastitis for those who might be unfamiliar? What is mastitis?
So mastitis is just simply an inflammation that the cow creates to try and fight an infection. It's an inflammation that happens in the mammary gland and the udder, and it's usually because some bugs have got in there and they've reached a tipping point and she needs to do something about it. So the somatic cells, the body cells, the white blood cells, they come in from the blood and they fight the infection. We measure the somatic cells through the somatic cell count. So we're measuring cells of the body. We're not actually measuring the bacteria at that point.
Okay, and Mike, why is mastitis such a big concern for dairy farmers?
Mastitis is probably the most common clinical disease that dairy cows get in all countries. So it's, I guess, an issue of international concern, and every market understands it, every industry understands it. It's an incredibly painful condition for the cows, so there's a welfare aspect to it. It requires antibiotics to treat, so that's time, money and faffing around, and that milk has to be discarded, so there's a loss of saleable milk to the farmer and processable milk for the processing company.
Okay, so A farmer might have just got their herd test results back and found some cows with high somatic cell counts. Jane, what is considered high somatic cell count and when is it nothing to worry about?
It's a question that people have debated for many, many years, but it really depends on the context. So for a lot of the time, a somatic cell that's up over about 200,000, we might technically say there's probably a high likelihood there might be some bacteria in there, but that really is still operating as an infection or an inflammation that's operating in the subclinical phase. So it's operating without any visible signs and it's below the radar, if you like. But we'll keep an eye on it, and those are the ones to keep an eye on. If the somatic cell count is moving up to the 500,000 or the million, it's more likely that it's starting to creep into what we might call the sort of clinical territory. We might actually be able to see some visible signs. So that usually when you get your herd tests, those are the cows to be going and having a closer look at, the ones at over 500 or a million. And we'd look at those and look carefully at the milk and see if we can find some clinical signs that then might say, yes, she probably needs some more support to help deal with the infection. If it's at the end of the season and we're thinking about drying off, then we might drop our threshold lower and use a 200 or 250 level. And that's when we're looking at what cows might have some bugs there that would value having some antibiotics in the dry period. So that's why we tend to have different thresholds for different things. And they're different to the bulk milk cell count, which sits at another level as well.
Right. Is high somatic cell count always an indicator of an infection, or can there be other causes of it?
There can be other causes. It can be a sign that the cow is recovering from an old infection and she's clearing a lot of the old damaged tissues. Cells go up very high when the cow dries off because it's a way of gobbling up the old milk and the casein and so on and getting rid of that. So it isn't always strictly bacteria causing the problem, but most of the time it is. And the ones we're looking for are the mastitis, is the infections that are causing problems and need help.
Okay. So, Mike, you support farmers with managing mastitis. If they've identified a cow with a high somatic cell count from a herd test, what should they do about it?
It really depends on the broader context of kind of what's happening on farm, what time of the season it is. So if you think about right now, for example, most farms are probably in peak milk. The highest risk period for clinical mastitis has passed. So, that's the first few days of lactation. This is when we tend to see the lowest average somatic cell counts. So if you did a herd test now and you've got one cow with a high cell count, maybe you do nothing. Does it matter? If it's really high, like if she's in the several millions, it may be that's a clinical mastitis case that you've missed. So it might be worth going and double checking. Let's assume this is a herd test. That's why you've got this number. And actually, it's not one cow. You've got a significant number, enough that we need to have a conversation about this. So again, the first step is you've got these high cell count cows, but what's your bulk milk? If your bulk milk's under control, maybe you just keep an eye on them. You're going to do another herd test in a couple of months. You see what happens there. If you think you might be missing clinical cows, it's probably worth drafting these high cell count cows out and going and having a look at them. Is there some kind of common characteristic? You could look at your records. Are they all older? Have they got the same participant code? Like, did you buy them all in from one place? That certainly is a biosecurity risk potentially. And then if you're going to go to the trouble of drafting them, put a mark on them and just go, oh yeah, in a week's time we'll go and RMT them again or something like that, just to see what that cell count is doing. Is it going up or down, or is it staying high? What is RMT? Rapid mastitis test. So that's those blue paddles that you squirt a bit of detergent in and slosh it around. You've got to remember that a herd test is a single point in time. It's telling you what those cows were doing on that day, and you don't know whether they were on their way up or on their way down. It could be that there's a clearing infection, as Jane said before. It could be that they had an environmental, an E. coli mastitis or something like that, which causes a very, very high spike in cell count, but then disappears and doesn't actually require usually any further treatment. The RMT test is a very convenient way for farmers to check cows in between herd tests. It doesn't give you a number, but it gives you a rough idea of whether a quarter has an elevated cell count or not. Thanks, Mike. So, Jane, let's talk more about the invisible subclinical cases, or those we've just heard you can make them visible through herd test and through RMT. So how do we diagnose and locate the exact quarter that's infected? Should we be considering sampling and testing for specific bugs at this stage? Mike just talked about a few different bugs. Yeah, so
Locating the actual quarter, it really comes back to using the RMT test. And so we will do a test on each quarter and see which one is the highest and see if one sticks out that's higher than the others. That's giving that thickening gel. Beyond that, if we wanted to look deeper and wanted to look for what sort of bug is causing the problems, we need to just back the truck up and make sure we know why we're doing it. If we're dealing with a herd situation where we've got a lot of high cell counts and a lot of new cows getting new high cell counts, then we would go and investigate. We'd take some samples from those high somatic cell count cows and look a bit deeper. And there's plenty of tests now that we can use to try and identify the bugs that are causing a high somatic cell count. If, however, we were dealing with a lot of clinicals back at the beginning of the season, then any new clinicals, we'd be trying to take a sample from those and get those tested to see what's going on with those. So there's certainly a variety of tests now that we can use to test for the bacteria.
Can I reiterate something there about the importance of defining your problem before you do the testing? That if you've got a problem with clinical mastitis, taking samples from high cell count cows at herd test is not going to address that problem. So you have to be looking at what is the problem on this farm, and then we need to sample the problem cows. So if it's high cell count cows, that's fine. You can often pick them up any time of the year. But if it's clinical mastitis, you need to be taking your samples from clinical mastitis cases, not just from random high cell count cows, because different bacteria cause different disease profiles. And so you do need to be intentional about which cows you're sampling.
Right, so if you feel like you're managing the clinical mastitis without too much concern and it's the bulk milk cell count that's a problem, the way you approach that is different.
Yes, I think there's a risk that, particularly on farms that have both kinds of problems, because that's not uncommon, that you go and you sample the clinical mastitis cases and you go, these are the bacteria that I need to work on, but actually you've also got some subclinical mastitis going on and you haven't sampled those cows and you've missed half of the picture. Testing is useful, but it needs to be within the context of the understanding of what is happening on that farm and what are the clinical presentations that we're trying to deal with.
Right. Thank you. Thank you both. Okay, so let's say we do decide to test. Mike, what are some of the common bugs that show up and how do you best treat cows for those?
Again, it depends on what your clinical presentation is. So broadly speaking, we'll talk about environmental bugs and contagious bugs or cow-associated bacteria. So that's where it is useful to know what bacteria you're dealing with, because the risk factors that you need to address for those different things. Probably most common mastitis pathogen is strep uberis, which is an environmental bug, causes clinical mastitis, usually early in the season. It's sort of a mud and feces associated bacteria. And then the second one that everyone will have heard of is Staph aureus, which is a cow-associated bacteria and can cause clinical and subclinical mastitis. You tend to see rates increasing throughout the year. And I guess it's famous for being more difficult to treat than strep uberis. So strep uberis got really, really high cure rate. Staph aureus isn't quite as high, but it is curable. You will get some cows who've got a really chronic infection and they've got little abscesses in the udder, and those ones less likely. But certainly for a cow that's had a first infection with Staph aureus, they're kind of 70% curable. So it's definitely worth trying.
Are there other types of staph?
Yeah, this is where it starts to get messy. So from a classification perspective, we talk about Staph aureus and then all the other staphs. So there's a bunch of other Staphylococcus species. They will be called CNS, so coagulase negative Staphylococcus, or NAS, non-aureus Staphylococcus.
Why do we lump them all together?
Because Staph aureus kind of is special, because we kind of think of it as especially difficult, or it was easy to grow is probably actually the real reason. And then all the other ones we thought the other ones tended to behave similarly because it was very difficult to tell them apart with the culturing technology that exists. And it's only quite recently that DNA sequencing has got a lot cheaper and we were able to more specifically define all of these other Staphylococcus that we're starting to actually think maybe we shouldn't be treating them all the same. It's getting more complicated, not less, in that we've probably got Staph aureus, who we understand reasonably well, and then we've got a couple of other staphs that are causing problems, and then some other staphs that aren't causing problems, and there's no way to tell those other staphs apart yet, or not for farmers at least. And so the conventional wisdom is CNS or NAS, those other staphs, they tend to be cow to cow, but they tend not to cause clinical mastitis. They tend to cause an increase in cell count, but not always. And it's often we'll jump to things like, oh, your teat spraying must be not very good to see that. And that's a reasonable assumption. But the world of staphylococci is not as clean cut as it used to be.
Okay, so those are the most common bugs that we see, but I know that some other ones pop up from time to time. Talk to us about those.
A good one to talk about is probably E. coli, that historically we have thought that rates of E. coli are very low in New Zealand. And, they're high in overseas countries where cows are wintered or barned. Where cows are housed in a barn, rates of E. coli mastitis tend to be quite high. But we weren't seeing that in New Zealand. So testing clinical mastitis cases, we didn't tend to grow very many E. coli's using the traditional laboratory processes. So a clinical mastitis case, you take a sample, you transport it to the lab and they grow it. Part of that is probably because of the length of time it was taking to get the sample through to the lab and that the E. coli was dying. And so the rise of on-farm testing has meant that we are now starting to appreciate that there's probably more E. coli mastitis going on than we used to think. And what's useful about that is usually E. coli mastitis is kind of short and sharp, and the antibiotics that we have don't work or don't have an impact on the course of the mastitis process. Sometimes with an E. coli mastitis, the cow will get sick, in which case you may think about using antibiotics, but I would definitely talk to your vet about that.
Right. So how can a farmer know on farm if they don't have any tests available on farm, whether they're dealing with E. coli, Staph aureus, Strep uberis?
They can't.
They can't.
That's why it's really important to take samples from cows that represent the problem on your farm. So if we're talking about E. coli, it's probably going to be a clinical mastitis case. So it's important to take samples from clinical mastitis cases, get them tested, and that helps you build a picture of the risk factors on your farm. If you don't have on-farm testing, you won't be managing individual mastitis cases based on the bacteria, but you will have in your head, on this farm, these are the types of bacteria that we deal with. And you'll find that profile differs quite a lot from farm to farm. There's only, let's say, a dozen bacteria of significance for bovine mastitis, but the ratio that you see them on every individual farm is different because of different management practices.
Okay, Mike, you've talked about E. coli. Are there any other funky bugs that are worth mentioning?
There are some kind of weird and wonderful ones that are uncommon but deserve a special mention, and those are probably the two there would be Serratia and Prototheca. Both cause subclinical mastitis, so elevation in cell count. Some farmers have described Prototheca mastitis kind of causing a rubbery udder feeling. But the thing that's important here is that they tend not to get picked up by quick diagnostic techniques. Like there's a risk that they get missed if you send samples in for culture, and you may get these back as a no growth. If you're having lots of cases of mastitis, high cell count cows that don't seem to be improving, or clinical cases that aren't resolving, talk to your vet about it. And they, when they send samples in, will make a special note to the lab, hey, we're just looking for something strange here, because they are harder to pick up, but they spread within your herd and they can be impossible to treat. So the sooner you get onto them, the better.
We have touched on detection and on treatment. What about prevention? Jane, how can we minimise future mastitis cases and reduce somatic cell count across the herd?
So Mike's given a really good description of the variety of bugs that can cause a problem. But a lot of it comes back down to fairly simple things that we can do. So a lot of it is about looking after the teats, looking after the teat health during the lactation. So anything that looks after teats is a good thing. Anything that keeps the skin smooth and supple and soft is a good thing. So make sure cows' teats are reasonably clean before we put the cups on, however we might do that, and clean and dry. Keeping an eye on the teat condition, trying to actually look at pulling up the teat ends and having a look at them regularly, or suggesting to the vet to come in and do some regular checks of teat condition. We're looking at teat spraying, so teat disinfection.
What are we looking for aside from suppleness when we're looking at the teats?
Just the absence of wounds. the absence of wounds and cracks and sores particularly around the teat end, and the roughness of the teat skin. Because anything that's rough and broken will harbour different bacteria. They're often a good site for the Staph aureus and other types of bugs that like damaged tissue. If we stop the damage, then we actually reduce down the number of bugs on the teats. That's hence why we look at teat condition and also looking at teat spray and making sure we've got the right mix of teat spray for the cow's teats and for the risk profile at the moment, and making sure that gets onto the teats after each milking. So those are those sort of elements. There's also looking at the milking machine and making sure the milking machine is working well, that it's not contributing to any damage, that we're not over milking. And so a lot of farmers have moved to a shortened up milking duration using things like max T, and that has actually helped reduce down some of the somatic cell counts and problems with over milking and teat damage. So a lot of farmers have gone down that path and found it's reaped good benefits in this mastitis space as well. So those are the main things during lactation, and then at drying off, we're looking at the appropriate amount of antibiotics to protect cows during the dry period or to treat the pre-existing infections that have come in at drying off.
Okay, so you mentioned using antibiotics when we're drying them off. Is there anything else we can do during the dry period to prevent infections?
So at drying off, we're really focusing on what can we do for the cows that have developed high cell counts during the season. And so those are the ones that we'll try and focus more on giving them a dry cow antibiotic. But it's of value for all of the cows to have some sort of protection using something like an internal teat sealant to help protect them during the dry period as well.
Thank you. Mike, when it comes to managing those cows with high somatic cell count, what's your advice?
It comes back to what's your individual situation on farm. If you've got a bunch of chronic high cell count cows that have probably got a contagious mastitis pathogen, you probably should be segregating those cows. But without doing bacteriology, you don't know what bugs are at play in your herd. However, it is important to keep in mind that farmers have been managing mastitis for decades, long before we were counting somatic cells, long before we were growing bacteria, we knew what they were. And there's actually a bunch of really simple principles that you can apply to your farm. And as long as you kind of do it consistently, it's been shown that you can manage mastitis out of your herd, basically. Not out, because there will always be some exposure, but you can stop it being a problem by applying the good old 5-point plan. If you think about the cows in your herd, some of them are infected, and some of them are not infected. And what you're trying to do is, the ones who are infected, help them clear up their infection and become uninfected. And you're trying to prevent new infections in the cows that are uninfected. That's it. There's mastitis management. Super simple. The 5-point plan does that by taking good records so you understand the infection dynamics within the herd, so which kinds of cows are getting infected when, and treat those clinical cases, but make sure you're writing it down as well. Using teat spray, using dry cow therapy where it's appropriate, and instead of using dry cow therapy, culling your chronic cases where it's appropriate. So if you've got a 8-year-old cow who's had a high cell count for the last 3 seasons, she's probably not going to come right. And if your goal is mastitis management, then moving her on is going to be the most effective option. If you've got a heifer who's spiked a high cell count on the last herd test, doesn't mean you should write her off. Even if she's infected with Staph aureus, for example, you go, oh, look, hi, what's this? It's her first infection. You've got a 70% chance of curing it, particularly over the dry period. The dry period's a great time to clear up Staph aureus cases. So, making those individual animal dry off and culling decisions, and look after your milking machine. That's it. But you've got to do those things consistently every day. When I go and talk to farmers who have really low cell counts, I say, what's your secret? They have attention to detail and they have a consistent process. That's it. And I get that that's hard. Farming is chaotic, particularly if you've got staff. There's just so many other things going on. But if you're serious about managing your cell count, you have to make it a priority. You have to go, what are all the things I'm going to do today that could impact my cell count?
Tell us again, what are the 5 points in your plan?
Number 1, treat and record clinical cases. Number 2, appropriate post-milking teat disinfection. Number 3, appropriate dry cow therapy. Number 4, cull chronic mastitis cases. Number 5, milking machine maintenance. Do those things and your cell count will, over time, decline. This isn't a sprint. This is a marathon.
Excellent. Thank you, Mike. Jane, where can farmers go to get other support, more support?
I mentioned earlier that there is a collection of resources called SmartSam, and those are the resources that support farmers and their advisors how to manage mastitis. And there are a series of tech notes and guidelines on the DairyNZ website. One of the things, most familiar things that people will have seen will be the Healthy Udder Guide as well. So this is a pictorial guide to dealing with mastitis. Have it near the cow shed or in the office so people can refer to it and see how to do various different tasks around the mastitis management side of things. Recently, we've also generated a fact sheet all about Staph aureus management, because there's been quite a lot of talk about how do we deal with mastitis cases that are caused by Staph aureus. So that's available on the website as well.
Mike, what extra support can Fonterra suppliers get?
Yeah, in addition to the great written support or material that Jane's outlined on the DairyNZ website, and I would say it's amazing resource, FarmSource do have milk quality managers in every region who can come out and talk you through mastitis control on your farm. For farmers who have had demerits during the season, we do have a demerit relief support system available where Fonterra can part fund veterinary investigation on your farm. So there's lots of options out there for farmers who are looking for help in this space. And just, I would say, feel free to get in touch with Fonterra or DairyNZ if you're looking for more options.
And I'm curious, Jane, obviously not all of our listeners will be Fonterra suppliers. Do other milk processors offer something similar?
They certainly have. There are milk quality managers with each of the dairy companies, and those milk quality managers are also able to access the resources at SmartSam and also through the vet training as well. So there will be vets who have been specifically trained using a lot of the SmartSam resources as well out in the different regions as well. The milk quality managers do talk to each other and do support each other as well in behind the scenes. So there's plenty of resources out there.
Brilliant. Thank you. And thank you both, Jane and Mike, for sharing your expertise today. Mastitis management is such a vital part of maintaining herd health, and I'm sure our listeners have gained some valuable or interesting insights. There's a lot of innovative diagnostic and prevention tech in this space, which is fantastic. But as you both pointed out, it's also about getting the basics right. And of course, if you need more advice on the most effective treatment and prevention options, always get in touch with your vet. If you want to learn more, check out the resources in today's show notes. Mā te wā, mauri ora. Thanks for tuning into this episode of Talking Dairy. Make sure to hit follow so you can keep up to date with our latest episodes. You can also keep up with DairyNZ News on Facebook, Instagram and LinkedIn, or go to our website and sign up for our fortnightly DairyNZ News emails. As always, if you have any feedback on this podcast or have some ideas for future topics or guests to have on the show, please email us at talkingdairy@dairynz.co.nz. Mā te wā, mauri ora, catch you next time.